To make it easy for learners of medical terminology, three common types of medical terms are raised here. The first one is words built from Greek and Latin word parts, such as ophthalmology and cardiology. The second is words used in modern English like CT scan and pacemaker. The third is words created from a person's name. They are called eponyms, for example, Crohn's disease or Hirschsprung's disease. In this course, however, we will mainly be focusing on the first type, which is the words of Latin and Greek origins, because they are the backbone of medical terminology, and they make up to 75% of total medical terminology. We will dissect them and clarify their word roots, prefixes, and suffixes. In addition, we will also address the other two types of medical terminology in the section of medical specialties. Now, let's start with the word root. The word root is a word part that is the core of the medical term and contains its fundamental meaning. The root of a medical term is usually a body part. Let's check these examples. Colostomy. Can you guess what is the word root in this example? It's col, which means colon. Let's see another example. What can be the word root here? It is arche, which means testicle. Let's have a look on the following examples, which will clarify more the meaning of word roots. As you can see from the table before you right now, cardi means heart, hepat means liver, colon. This confirms that the word root is usually a body part, as you can see. Take a moment and check the other examples and try to visually link them with this photo of some body organs. Let's now move to the part of suffixes. Suffixes are word parts that are located at the end of words. They can add meaning by indicating a condition, procedure, disorder, or disease. Their meaning don't change from word to word. They are invariable. This table is the best example of how suffixes work. As we can see, each suffix has a fixed meaning and determines the action, status, or quality of the word root, as you can see from the table in front of you right now. Pathy is a suffix, which means disease. When you add it to a word root, which is retina, it becomes retina disease. Another example, itis means inflammation. Added to the word root hepat, it becomes liver inflammation. Ectomy is a suffix, means surgical removal. If you add it to tonsil, which is a word root, it becomes tonsillectomy, which means surgical removal of tonsils. Algia as well means pain. Added to a word root, which is meaning muscle. Myalgia means muscle pain. The same thing applies to the suffixes plasty and gram. But don't worry, immediately after this chapter, we will have another chapter dedicated to suffixes and only suffixes, where we will highlight all types of suffixes. Unlike suffixes, prefixes are word parts that are located at the beginning of a medical term. They often indicate information such as abnormal conditions, numbers, positions, or times. And most of them are used in everyday language. This table, like the previous one of suffixes, it highlights some examples of prefixes and shows them while they are in use. Let's read over this table. The prefix bi means two. If you add it to the word lateral, it becomes bilateral, which means two sides, like bilateral orchiopexy. Uni means one. If you add it to the word lateral as well, it becomes unilateral, which means one side. Let's go to the third example. We find post, which means after. For example, post-surgical appointment, which is the appointment that the patient gets with the physician after the patient has had a surgery. Sub means below or underneath. The example we have in the table is subcutaneous, which means underneath the skin. Inter means between. Added to costal, which refers to pertaining to ribs, it becomes intercostal, meaning between ribs. Tachy means fast. When used in this medical term, cardia, the medical term now means fast heartbeat. Again, don't worry, this is just an initiation. We will have a detailed chapter on all types of prefixes. Let's talk now about the combining vowel O in medical terminology. The combining vowel is used for mainly two reasons. First, to connect word parts, and second, to make medical terms easier to spell and pronounce. More explicitly, combining vowel, which is O in medical terms, is used before suffixes that begin with a consonant and before another word root. It is always said that explaining with examples does the job. So in rhinoplasty, you notice that the combining vowel, which is O, is added because the suffix plasty starts with a consonant P. Hence, the rule says that a combining vowel is always used before suffixes that begin with a consonant. Keep it in mind. In the second example, osteoarthritis, as you can see, the combining vowel is added between oste and arthur. As a result, and as a rule, the combining vowel is always used before another word root, even if the second word root, art in this case, starts with a vowel. For the sake of more clarification on this part, this table is complementary to the previous one. In the first example, arthritis, the combining vowel shouldn't be there, because the rule says that never use a combining vowel before a suffix that begins with a vowel. The second example should have a combining vowel between the two word roots, because as it was emphasized earlier, a combining vowel is always inserted between two word roots, no matter what letter the second word root begins with, either consonant or vowel.